Amazing. Now you do the afterwards.
Why, hello! Hello! Are you here to Dr. Sir?
Yes.
Right this way. I need a pickle.
Gotcha. Of course, honey.
Thank you.
I just love the way you eat.
Hello there, Mr. and Mrs. Allen.
Hello. Hi, Mr. Allen.
Please have a seat. We've come to talk to you today because we're a bit concerned. This is our first child, and we're afraid it might have Down syndrome.
Well, you have a good reason to be. When a woman's this old, you...
Oh,
Sir, contain
how
yourself!
dare you! No, cannot even believe you would say so! Preposterous!
Please have a seat! Please. As I was saying, there's a 1 in 100 chance of your child having Down syndrome.
How can we be sure?
There are ways, but since you're so far along, prenatal testing is out of the question. Amniocentesis is most commonly done at 15 to 16 weeks of pregnancy. Now, the only real way to test is after the baby is born. Ignore that, that's our psychiatric ward. As I was saying, I'll have my assistant, Miss Johnson, tell you more about it. Miss Johnson? Miss Johnson? Mrs. Johnson! Yes? You calling for me?
Okay, so after birth, we send a sample of the baby's blood to carrier type. If we see the trisomy. Yeah, that's right. Trisomy of chromosome 21 that causes Down syndrome, we look further into what form of syndrome it is.
I see. So, is Alzheimer's at all connected to Down syndrome?
Just because Alzheimer's runs in your family doesn't mean that the baby will have Down syndrome. Alzheimer's is caused by too much compound in the brain called amyloid beta. And an extra 21st chromosome is what causes Down syndrome. However, when a person has Down syndrome, the risk of them having Alzheimer's at age is very high.
So, if our daughter does have Down syndrome, how exactly will it affect her?
Well, she looks a little bit differently. For one, she'll have a flat face, a short neck, and her eyes will have an upward slant. But other than that, she'll be mostly normal. She'll be able to learn and do everything as a normal child does, but at a slower pace. Children affected by Down syndrome do have some health conditions, though, such as celiac disease, intestinal problems, heart disease, hearing, and seeing problems.
So, if we have another child, will it be affected by Down syndrome too?
Chances in having Down syndrome in the next child are the same as they are right now, 1 in 100. Down syndrome isn't recessive or dominant, but it's autosomal. So basically, it's a non-disjunction mutation where there are problems moving the chromosomes during meiosis, causing an extra chromosome to be added to chromosome.
So basically, it's not inherited, and it can't be cured or prevented?
Correct. But there are ways for early intervention. I have a book, conveniently located in my briefcase, that can help you during this process. Now, I have a few appointments, so I have to leave. Are there any further questions?
No, ma'am.
Thank you. I hope you all have a great day, and I will see you later. And thank you for coming.
Right this way.
Oh, thank you.